Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a very specific thumb condition referred to as skier's thumb. So essentially what skier's thumb is, it's an injury to the lateral collateral ligament on the thumb. So essentially the side portion of the thumb here, there is a ligament. So what ligaments do is they help to they attach bone to bone and they help with stability. And what happens in this case is this particular ligament, it actually becomes overstretched and damaged. Now, typically what happens in these cases is it'll be a result of either a fall on an outstretched arm, or and the reason it's called actually skier's thumb is you see a lot of skiers get this where they'll be holding on to the ski poles and then they fall forward on the pole, and the pressure on the pole actually puts again a pressure in through the thumb region, which then pulls the thumb laterally and puts again this pressure directly on that particular ligament. And then there can be different grades of ligament sprain as a result of this particular fall. So a grade 1, a grade 2, or a grade 3, depending on the degree of the sprain or tear. So a grade 1 is a very mild sprain of that particular ligament. A grade 2 is a partial tear. A grade 3 is a full tear. Now with this particular injury, the patient will find that any sort of pressure in through that thumb region where there's direct pressure down through it, or that puts it in through that particular injured position, will be quite sensitive and painful. And so the way that we typically want to treat this condition is you actually brace the thumb initially, and again it's to avoid that very painful position. Then typically with that you're usually looking at about a 4 to 6 week period of time in terms of immobilization. Then from there you actually want to do some manual therapy in order to regain mobility in through the thumb region. So during that period of time when the individual is wearing a splint of some type, the thumb will get really tight and stiff, and some of the muscles in through the wrist or forearm region will also get quite tight. And so it'll be really important to regain that range of motion, that mobility, after being in that brace. The other thing too that'll happen is the muscles that surround the thumb will get quite weak as a result of again the immobility. So it's important then to do specific strengthening exercises that typically involves isometric exercises of the smaller muscles that surround the thumb joint, and then some sort of gripping exercise to build up the intrinsic muscles and the dexterity within the thumb region, because again the thumb is going to be really important in terms of these fine motor skills. From there we'd want to actually make the exercises more specific to whatever activity the patient wants to get back into, whether that's a sport of some type or any sort of, again, recreational activity. Thanks again for watching, and please make sure that this information is appropriate for you by speaking with a physiotherapist. And again, if you enjoy these videos, please subscribe, and that way you'll be notified in terms of when new videos come up. Thanks again, and have a great day. Take care.